When you think of immunizations, you might associate them with a child's vaccine schedule. But did you know there's several important vaccinations adults should get too? In this episode of Being Well, I'll sit down with HSHS St. Anthony's Memorial Hospital CMO Dr. Jennings to talk about how to make sure you're up to date on all your shots.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for another episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming back a dear friend of the show. Today we've got Dr. Jennings with us. Welcome back to Being Well. It's so good to see you.
Oh, it's great to see you guys. Thanks for having me again.
Of course. For our friends at home who maybe haven't got to meet you yet, got to see an episode featuring you, can you give us a little introduction to the many hats that you wear?
I do have a few. I'm privileged to serve as the Chief Medical Officer for HSHS in several of their facilities, including our hospitals in Litchfield, Greenville, Shelbyville, Effingham, and Decatur. So in my spare time, I'm a doc. So I also still practice a little bit. I'm an internist and a pediatrician, both by training. And so when I can, I work a little bit clinically, so I stay close to the patients at the same time. Get the privilege of serving the communities.
Awesome. So you definitely get the best of both worlds there, which is great. Today we're going to be talking about vaccinations, which I think a lot of people probably think just kiddos, just kids with their vaccine schedules and making sure they're up to on their shots for school. But we're actually going to be talking about some for adults. So just to kind of introduce though, what are vaccines? How do they work?
You know, the vaccines are really pretty amazing. I mean, when you think about the advances in public health, there's really only been two things, public sanitation and vaccines. I mean, they really changed the world completely. And so you're right, you know, the children vaccine series everybody's pretty familiar with. The adult vaccine series has changed tremendously, but the concepts haven't changed. So really the idea of a vaccine is that they take some part of a bacteria or a virus and kind of weaken it or even kill it completely, and then administer it to the person either through shots, what you think of most commonly, but there are some vaccines that you do through your nose or orally or things like that. But most of the time we think about it as an injection, and it basically triggers the body's immune system to respond to it. And so the immune system revs up, kills it off, and then it creates a memory. So the amazing thing about your immune system is that once it's been exposed to something, then it remembers it. So the next time that it comes in, it'll attack it much more quickly. And that's part of why you have boosters and things like that, is to really get the immune system revved up. So, you know, so when I give you a measles vaccine and you know, you've never seen measles before, you don't particularly get sick, but then if you ever are out and about and you run into measles, the body immediately attacks it and then prevents you from becoming ill. So it's really a very clever mechanism to help your body to recognize when something's intruding from the outside, attack it, and get rid of it.
Gotcha. So you're giving the body some sort of evidence. Hey, here, look out for this, be on watch for this, and now you can attack it more properly.
Quickly, yeah.
Yeah. Gotcha. So I think some people may be kind of concerned or curious, do they work? How effective are they?
They do vary a little bit. The flu shot's always the one that gets a lot of gaff every year because it does vary a lot from year to year. Some years, because of the way that the flu shot's manufactured, it's changed every year to match up with what's circulating around the globe. So they're really changing that vaccine every year. Some years you get a really great match and they're wildly 80-90% effective. Other years not so hot, they're only 50-60% effective. But some of the other vaccines, like the measles, mumps, rubella vaccine, are well into the upper 90s. They're incredibly effective. So there is some variation. The live vaccines are the ones that are done with what we call an attenuated virus, where we kind of weaken the virus, tend to cause a bigger response and be more effective and not have to have so many boosters. When you use a killed vaccine, that's when you usually have to have some boosters and things like that. But although there's some variability, they're overall extremely effective, and certainly more effective than some of the other options, which, as you know, for viruses, we really don't have treatment. So prevention is the answer to viral illness.
Right, otherwise you got to just fight it out alone, and
Yeah.
that can be one heck of a trial on your immune system there. But kind of speaking of that, sometimes folks will get a vaccine and then they might experience illness shortly after. What's that about? What's happening there?
So there's two things. One is kind of that immediate, your body revs up to fight off, because you introduced this intruder into the body. And if the vaccine's a good vaccine, then your body gets mad at it and attacks it. And so a lot of people just in the first day or two will get kind of flu-like symptoms. They'll get soreness at the injection site. They may run some low-grade fevers, but usually only last a couple of days and is more take some Tylenol and you'll be okay. But because they're not all 100% effective, it's not unusual for somebody to say, hey, I got my flu shot, but I still got flu. And but the good news is, and we experienced a lot of this with COVID, you tend to not get nearly as ill when you do get it because your immune system's already attacking it and kind of slowing it down right from the get-go. And for many, many diseases, especially some of the ones we'll talk about today, they usually keep you out of the hospital, which is obviously a good place to avoid, and unless you're there as an administrator, then it's fine. And prevent mortality, which is really the end game, is you become extremely unlikely that some of these diseases that are traditionally very, very dangerous, if you've been vaccinated, even if you get the disease, it's not likely to be fatal.
So it's almost kind of like a tier system of experiencing these symptoms. As you weaken it, it might not be as severe. You might still get the, like you said, the fever and the not so great feelings right after the shot, but if you were to still contract the flu, you're saying it's not as intense because it's already had that first round.
Correct. You're better off. And especially folks that maybe are predisposed with some type of weakened immune function where they might really get sick if they get the disease. Some of the vaccines then can help them to kind of have their immune system ready to go when they are exposed and lessen the chances of severe illness.
So we kind of hit on that we usually think of the child's vaccine schedule, but when it comes to adults, what types of vaccines should we be considering?
Well, this is kind of crazy to me because, I brought a prop this time. I brought a prop.
Lovely.
And then I had to bring glasses since the last time you saw me because suddenly I got old.
Oh, I'm wearing contacts. I couldn't see the camera without mine. No.
But no, truthfully, this list used to be kind of the flu shot, a pneumonia vaccine, and a tetanus booster periodically. That was about all that was on the list. Well, now then, with some of the advances, that list looks dramatically different. We already kind of talked about the flu shot. The pneumonia vaccines actually changed dramatically and covers a bigger spectrum of pneumonia strains because one pneumonia is not all the same. There's different strains of pneumonia. And so the newer vaccines, one, are more protective. They do a better job at triggering the immune system, and they have a broader number of strains that they cover. So that's one that folks really should consider. Of course, the flu shot's every year. The pneumonia vaccine is just a couple of times in your lifetime, but you need to talk to your doc because there's 2 or 3 different versions of the pneumonia vaccine, and it depends on which ones you've had in the past. And I mean, there's a lot that goes into picking and choosing. So one of the main things to point out today is now that we're talking about adult vaccination, get in with your doctor and go, what am I supposed to be doing here? You know, because the choices are huge. Some of the biggest advances is, for the first time ever, we have RSV vaccination, respiratory syncytial virus, which is a huge deal. You know, we always thought of it in kids, and that's one that about 90% of kids will have by the time they're 2 years old. So very, very common in children, and a leading cause of hospitalization. And in kids, we finally got some decent vaccination strategies for them, but now we have one for adults as well, and even including one that you get administered to pregnant women that then passes immunity on to the baby when the baby's born, to hopefully keep them from getting RSV during that critical first few months of life. When that's when it's really crummy. I mean, we used to always think in an adult RSV was just a snotty nose. Well, then we got better at testing, and it sure turns out that RSV is a lot more common in elderly folks than what we realized. And we'd have these, you know, horrible looking pneumonias on the chest x-ray, and we're just thinking it's just a pneumonia. And then now with testing, we're finding out more and more that that was RSV, and is absolutely, you know, terribly difficult, because again, treatments are pretty much give you some oxygen and you know, hold out until you're over it. So being able to prevent it with a vaccine is an enormous advancement, especially for elderly people. So that's one to definitely get on your list to talk to your doc about. A couple other big ones. One that's absolutely fascinating, and this isn't necessarily an elderly vaccine, but an adult vaccine, and that's the human papillomavirus vaccine, the HPV vaccine. And you're seeing that on television now. You can start to administer it as early as age 7, I believe. Don't quote me, I might be off just a tad, but I believe you can start as early as age 7, but all the way up to age 45 for folks that are at risk. What's really fascinating about HPV is that it's the first vaccine we've ever had that actually prevents cancer. So we know that a lot of rectal cancers, cervical cancer, some of the head and neck cancers are actually caused by this particular virus, and with administration of this vaccine, it actually prevents a cancer. So that's a huge breakthrough. Yeah, I mean, that's a huge breakthrough in medical science that is exciting. And then the other one that's really been a great success in the elderly population, because it's so miserable, is the shingles vaccine. Shingles is miserable. So shingles is caused by the same virus that causes chicken pox. And after you've had chicken pox, which most of us have, or even for those that haven't, those that are vaccinated, you still have the opportunity to potentially get shingles. And the virus goes and lives in the nerves in your back, and then will reactivate and then put a patch of just incredibly painful skin and blisters, kind of like a shingle, across, you know, because it stays in one little patch. But depending upon where that is, you know, the amount of pain that people go through is absolutely devastating. Or it can actually affect the face, and it can take your vision. You know, it can cause some very, very serious illnesses. And so the shingles vaccine is another one that you want to spend a little time with your doc to find out if you're the right candidate for it, and get that one. So. So lots of new adult vaccines, and that didn't even touch all of these. Of course, the tetanus booster is still out there, so you want to think about that. But part of what we've learned about it is we normally, in kids and stuff, you think about tetanus and pertussis are in a combined vaccine. As we got old and smart and realized that pertussis was back, then we've started to boost people's pertussis when we give them a tetanus booster now too. So when women are pregnant and get a tetanus booster, they get boosted for pertussis, with the idea that then that prevents them from getting sick, that will hopefully prevent their child from acquiring the disease after the delivery. So it's a 2-for-1. So lots of stuff. It's definitely an appointment-worthy conversation with the doc, because there's just a lot to it.
No, and you want them keeping track of it, because if it's a lot, I mean, hey, please, you all keep great medical records. You let me know whether I have had this. Can you ever accidentally get it too many times?
There's very little risk of either too close a doses or too many times. Very, very little risk of that. Once in a while, somebody that gets tetanus boosters really close together can kind of get a funky reaction. But the rest of it, the biggest problem with too frequent or too close is the body. What you want the body to do is react to the vaccine, start to kind of lose that immunity a little bit and come back down, and then get re-exposed to it, so that then it reacts in a more robust way. So that's why, children's vaccines are spaced out over a period of time. Adult vaccines are spaced out over a period of time to purposely re-trigger that immune system. And each time you do that, then when you're exposed to the native disease, the natural disease, it's a more robust response to it and more likely to keep you safe. So same is true of combination vaccines. Folks often ask, hey, can I get, of course, when the COVID vaccine was a big deal, can I get my flu shot and my COVID vaccine at the same time? Can I get my pneumonia vaccine at the same time? Absolutely. The body is absolutely brilliant at figuring out that you got more than one vaccine and responds appropriately to all of them. So no problems with receiving either combined vaccines and or more than one dose of it, or more than one type of vaccine at the same time. So.
Now, we've already kind of hit on it, but what makes these diseases so dangerous when it comes to adults?
So the majority of the ones that we're talking about, with the exception of the shingles one, they cause terrible respiratory illnesses primarily. And, pneumonia is the old man's friend. It moves a lot of people on. and so anything that can prevent the possibility of either getting a secondary pneumonia or just a severe respiratory disease like RSV, COVID, et cetera, improve survival. And of course, anything we can do to keep you out of the hospital, keep you healthy is a good thing. They're especially dangerous for folks, the diseases are, that have something else. They've got an immune system issue, they've got diabetes, they've had heart failure, they've got liver problems. So their body's not in tip-top condition to begin with, and a minor illness can really tip them into a big problem where, you would think, well, you're just going to get a cold. But it turns out, because you've already got lung disease from COPD and smoking and that type of stuff, you get really, really sick. And so really the game is always to improve survival. That's really what it's all about.
Right, and watching those comorbidities, just to really, really cement why you should be making sure you're up to snuff on your shots.
Yeah.
So I think you had mentioned measles. Why are we seeing more measles and then some of the other diseases that we thought we'd kind of eradicated?
Yeah, so measles is a fascinating disease. Knock on wood, we officially said it was eliminated from the United States in 2000. And when the World Health Organization says something's eliminated, that doesn't mean it's gone from the earth. That just means that we haven't seen it naturally transmitted in the United States for over a year. Well, a few things kind of come together all at once. One is that it's a wildly transmissible virus. So, when I remember when we talked about COVID and all that fun stuff, that R naught value that says, okay, if you walk in the room with somebody that has COVID, the chance of spreading it was you'd spread it to 4 people out of 100. If you walk into a room with measles and there's 10 people in the room and they're not vaccinated, 9 out of the 10 are going to get measles. I mean, it is wildly contagious. So when it does break out and it gets around anybody that's not vaccinated, the likelihood of that person getting it causes spread. 2 is global travel. So, you have diseases that maybe we don't have that much prevalence of, but they have an incubation period. So measles can incubate up to 21 days. Well, shoot, I can be around the world in 21 days in multiple countries. And, so if I'm out there carrying around with measles and not even sick yet, to my knowledge, it can be a really big problem. And then 3 was we had some wane in the percentage of people that were being vaccinated. A couple of things led to that. One was people got off cycle because of COVID. I mean, the children vaccination program had a lot of problems because appointments got delayed and a lot of reasons why it happened. And then there was also concerns about vaccine that circulated at the same time. So we went from having upper 90s for a vaccination rate for measles down into the low 90s, and with something that is that contagious, that's all it takes. So once it started to kind of reemerge in the U.S., when it gets in a population that doesn't have a high vaccination rate, it spreads like wildfire. But we can fix it. I mean, it's a very easy, accessible vaccine. As I mentioned earlier, really, really effective vaccine. So we just got to get back in the pattern and get everybody caught back up on what they missed, and hopefully we'll see that one go away. We almost have polio gone. I mean, it is that close to being gone. So really exciting to see that. Lots of credit to the Rotarians of the world that have helped to get us so close to the complete eradication of polio from the earth, which is, I mean, huge. I mean, I still have folks that, suffer the consequences of polio that they had as a child with, a limb that doesn't work or pain and things like that. So wildly effective vaccine, and one that I think we're going to get there. So, and of course we got there with smallpox. So gone. So there's a lot of great work that can be done with vaccination.
And I know you've encouraged people to be talking to their doctor about getting these shots scheduled, those sorts of things. Is my primary the only place I can get those types of vaccinations, or maybe a local health department?
Actually, health departments, pharmacies. We now see a lot of the pharmacies now administer vaccination. And one of the great things that the public health department has done, especially in Illinois, is there is a central registry now. So when they give you a dose of whatever you're due for, you get your flu shot at the pharmacy this year, that goes into the central registry, and then your doc can see it on his side when you go to see him and see that's been given. The other thing the health departments especially are really great about is they tend to be very low cost. So if you happen to have an insurance plan that doesn't cover vaccination, Medicare and things like that generally cover vaccines extremely well, because they don't want you in the hospital. It's the most expensive place on earth. Right. So, so if they can keep you out of the hospital, they want you out of the hospital. So generally speaking, they're well covered, but the health departments in particular do a great job at very low cost vaccination. In fact, most of the time free.
Love that. If it's for free, it's for me. As we're in our last couple of minutes here, is there anything about this topic that I haven't asked about that you think is important for people to know?
It really, one is re-emphasizing it's so complicated. It is a go see your provider conversation and kind of wade through it. There's also occasionally a reason that somebody can't get a vaccine. The most common things you see are live vaccines in someone that is immune compromised. So, we see all those great drugs on TV now, what we call biologics, or for Crohn's disease and psoriasis and things like that. Well, those reduce your immune system, and so in some folks, then certain vaccines are not a good idea to administer. So those are conversations you need to have with your provider to figure out what's the right dose for me, or what's the right medication for me. A lot of times there's options, so just because you can't get this one, you can still get an RSV vaccine of a different brand, and it's completely fine. The other topic, of course, always is pregnancy, because although most vaccines that have ever been studied are seemingly safe in pregnancy, it always makes people pause, and so and rightly so. So talking to just to again make sure that you're not somebody that shouldn't get a vaccine at that particular moment in time, but mostly just the ability to ask questions and understand more about these diseases, why they're important, and what the vaccine can do to keep you safe, and of course keep washing your hands. That's the other thing.
That was my next question, because for those communities who those types of folks who aren't able to get these vaccines, I know you're a big champion of hand washing. Is there anything else as far as trying to keep myself healthy in the cold and flu season?
Well, staying away from people that are sick, and yourself, if you're sick, not going out and spreading it to the to the world. So trying to recognize illness, I think we're better at that than what we used to be. There's a lot more of I'm not feeling good, I think I better stay home, as opposed to go wiping out my entire coworkers. So I think we've gotten better about that. But the old hand washing and those types of things are still what's tried and true when there's not really a vaccine option.
Very well put. All right. Well, Dr. Jennings, thank you so much for making time for us today and ironing out the adult vaccine type schedule. We appreciate your time.
Anytime. Glad to do it.
Of course. And we thank our viewers for joining us for this episode of Being Well. We hope you learned a little something about when you should get your shots and maybe not. And we hope to see you in the next episode.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
Next time on Being Well.
Naloxone, commonly known as Narcan, is an over-the-counter treatment that can save a life in an opioid emergency. In this episode of Being Well, I'll speak with Horizon Health's Sean Robison and Adam Webb about how someone goes about getting and giving this life-saving treatment.